Hi guys, my name is Sanjay Gupta. I'm a consultant cardiologist, and it's about 4 o'clock, not 4 o'clock, it's about midnight in Vienna. I'm here to attend a conference on Afib, and one of my friends, Kate, you know who you are, asked me to put some videos out on the subject of Afib because a lot of people suffer from Afib. In fact, 1 in 4 of us will develop atrial fibrillation by the time we're 80. And the big problem with atrial fibrillation is the risk of strokes. And this is the big risk associated with atrial fibrillation. And today I wanted to do a little video to talk about the risk of stroke in atrial fibrillation and what you can do to try and avoid strokes. Okay. Now, I have always been of the thought that atrial fibrillation occurs because you have something like high blood pressure or because you're old. And what tends to happen is that the heart is having to pump against a higher pressure, for example, with high blood pressure or with hardened arteries. Because it's having to pump harder, the pressure inside the left ventricle, which is the main pumping chamber, is increased. Now, the atria are thin-walled structure which pushes blood into the left ventricle. So if the left ventricle has higher pressure, the atria has to work harder to get the blood into the left ventricle. Now, because of that, and because of the atria being a thin-walled structure, what happens is with time it gets bigger and bigger and bigger, and eventually it loses its elasticity, and at that point it stops working, and that condition is called atrial fibrillation. And I always used to explain to my patients that, look, atrial fibrillation is associated with less blood coming out of the heart because the atria is pushing blood in to the left ventricle. Most of the blood in the left ventricle just goes in passively, but then the atria adds a little kick and just fills it up. And if you develop atrial fibrillation, then the atrium has stopped working, and therefore there's less blood in the left ventricle. And because there's less blood in the left ventricle, less blood is going to be pumped out. And therefore some blood, which would ordinarily get pumped out, sits within the left ventricle and or sits within the heart and can stagnate and can form a blood clot. And that is why most people would recommend thinning of the blood to try and prevent clots from being dislodged and going to the brain. Okay, and that is why a lot of people go on blood thinning medication. Now, the first thing to say is aspirin is not an effective blood thinning medication for this purpose. So number one, if you don't want to have a stroke, don't take aspirin for it. Okay, you need to be on a stronger blood thinning medication if it is felt that you are at a higher risk of having strokes. The second thing to say is that the blood thinning medications include warfarin or the NOACs, and I have spoken in a previous video about the advantage of NOACs over and above warfarin. And the big advantage is that NOACs work almost instantaneously, so you're not having to wait for a period of time before the warfarin thins your blood. The other advantage is that they provide a more consistent level of blood thinning. And the third advantage is that they cause less bleeding risks compared to warfarin. And so if you wanted to avoid having a stroke, then of course it's a good idea to be on blood thinning medication, and ideally you want to be on one of the newer blood thinning medication. Which new blood thinning medication? Well, the most efficacious agent for preventing stroke in atrial fibrillation is dabigatran, 150 milligrams twice a day. However, that is associated with slightly higher bleeding risk, particularly gastrointestinal bleeding. But if you want the most effective agent available to prevent strokes at this point in time, it is dabigatran 150 twice a day. However, it is also important to bear in mind that even if you are on dabigatran 150 twice a day, some people will still go ahead and have strokes. And therefore, I got interested in this. Why, if you are thinning the blood to that level, should people still go ahead and have strokes? And the answer is this, that increasingly, we are now beginning to understand that atrial fibrillation may be an inflammatory condition, okay? It may be a byproduct of increased inflammation, and therefore, it may well be the inflammation which also increases you to having strokes. In fact, if you look at patients who have had bypass operations, almost 2 or 3 days after their bypass operation, when their inflammation levels are quite high because of what's happened to the heart, they often develop atrial fibrillation. And there's a good link between inflammatory levels and the presence of atrial fibrillation. And the problem with inflammation is that it can cause bits in your blood vessels to break off, and that can cause sudden clotting of the blood. So you can suddenly develop a sudden blockage in a blood vessel because of inflammation by itself. And that may be over and above the benefit conferred to you. The risk may be more than just the risk of being in atrial fibrillation. So what I'm trying to say is that even if you are on a blood thinning medication, that does not provide foolproof guarantee that you are protected against the risks of a stroke, because a reasonable number of patients can still go ahead and have strokes. And the problem is that majority of people think, oh, well, put the patient on blood thinning medication and that's it, job done. Actually, it's not. The job is not done. You have to start thinking of how you're going to reduce the patient's inflammatory levels, all right? And I'll tell you a few other interesting things. One, we know that things like statins, for example, are anti-inflammatory, and they have been shown to reduce stroke risk in atrial fibrillation. And so it's always just worth bearing in mind that there may be an inflammation component over and above just a clot getting dislodged from the heart and going to the brain. And therefore, it is incredibly important to look at one's lifestyle and find out and see if you can modify your lifestyle to minimize your inflammatory levels, okay? Number one, that means improving your nutrition, avoiding sort of things like supermarket food, avoiding preservatives and additives, and improving your general nutrition will help reduce your risks of stroke. Number two, avoiding things like smoking, which is hugely inflammatory to the body, over and above taking blood thinning medication, okay? If you take blood thinning medication and you continue to smoke, you are going to be at a higher risk of having strokes. So what you need to do is you need to modify your lifestyle as well. Nutrition, avoiding smoking, getting regular exercise is really important, okay? Not too much exercise, not running ultra marathons, but equally well, not being completely sedentary, but doing 10 to 30 minutes on a treadmill is really good, okay? And reduces your risk of having strokes. And that reduction is going to be over and above just being on a blood thinning medication. Getting enough sleep is incredibly important, okay? Minimizing your stress levels is incredibly important, okay? Statins can help because they're anti-inflammatory agents. And those are other things that you can do for yourself to minimize the risk of stroke. So I would say, number one, obviously go on a blood thinning medication. Number two, make sure it's not aspirin because that has no role. Number three, if you have to go on warfarin, you need to be absolutely sure you're getting enough warfarin and your blood is nice and thin. But better still, go on a NOAC. If you're going to choose a NOAC, try and choose dabigatran 150 twice a day, unless your cardiologist thinks that it's unwise to put you on that because of a higher bleeding risk. And then think about modifying your lifestyle, all right? And think about statins as well, or speak to your doctor about statins. But certainly think about modifying your lifestyle, nutrition, exercise, improving your sleep, minimizing your stress levels, all right? So I hope this was useful. My name is Sanjay Gupta, and this is me. And this is my website. And this is my Facebook page. And this is how you can contact my secretary, Jeanette. All right? All right, all the best. I better get to bed. Take care. Bye.